this is section E. We're talking about estrogen hormone metabolism, production of it, elimination of it, and how it influences the tissues of the body. Because estrogen is a very, very important hormone that influences men, both men and women. Now, here, these are the tissues. This is part E. We're focusing on tissues. So, how does estrogen influence the tissues? Well, the endogenous estrogens, those are the ones produced in the body. The exogenous ones we just talked about in the last section. The exogenous estrogens, the phytoestrogens. Now, phyto means plant, and so these are the estrogens that are naturally occurring in plants that we may take into our bodies. And xenoestrogens, which are the foreign estrogens, the ones that are environmental toxins from plastics, as we mentioned before, and a variety of other sources from fuels, things like that, that mimic estrogen's effect, the natural estrogen. We don't want all those extra estrogens from the outside of influencing our body, because our body produces and can produce enough estrogens at the right time when we need them. So, all of these different estrogens and estrogen factors have an influence on the tissues in our body which have estrogen receptors. So, what are some of the estrogen responsive tissues? Well, it includes the breast, uterus, ovaries, cervix, prostate, testes, and bones. I'm sure many people have heard the production of bone and the strength of bones can decrease in both men and women over time as they get older. And in women, actually, starting age 16 or 18 is when bone loss starts to begin. But when women pass through menopause, the estrogen levels in their body are decreasing. And estrogen is a important hormone that helps to build bone mass. So that's why there's this concern regarding having sufficient estrogen in the body in women during menopause so that they don't get fragile bones. But at any rate, the bones are responsive to estrogen, and the response is to promote the buildup of more calcium and other structures that are related to the bone, other materials that actually make bone stronger. So that's this upper portion of this chart that we have circled here. Estrogen affects these cells, again, in like the breast, uterus, ovaries, cervix, prostate, testes, and bones. The estrogen affects these cells' growth, health, and function. Too much estrogen or estrogen-like stimulation of these cells can lead to such conditions as uncontrolled proliferation of cells. And this proliferation means a lot more cells being produced. It can either be benign or it can be malignant. In other words, the cells can grow and they can be healthy cells, or they can actually be unhealthy. They can be altered, and malignant means cancerous. So this again is why we want to be sure that we're keeping the amount of estrogen in the body in a better level by not doing blood sugar surges, having properly filtered water to clean out the xenoestrogens, not being too fat because that can produce more estrogens, and also bowel health, which we mentioned before. So let's move on to section F, where we're going to discuss the clearance of estrogen from the body. And we're going to talk about the good, the bad, and the ugly ways that it can be taken out of the body, and exactly what each of these signifies. And this is significant from the standpoint, as I mentioned before, of not only healthy metabolism of estrogen in women who are menstruating, and also in men, normally in men, as well as men who have prostate cancer and are being treated for that, as well as women who are undergoing cancer treatments for estrogen-dependent cancer. So pay attention. We're going to move on to the next section on how does the body actually remove these out of the body, the excess estrogen pool.